Good morning and thank you for joining us. My name is Tina Tebow and I will be your moderator for this morning's news conference. Joining us today, the Honourable Zach Churchill, Minister of Education and Early Childhood Development, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Both Minister Churchill and Dr. Strang will begin with some brief remarks, and then we'll take questions from reporters on the line in the allotted time we have. Go ahead, Minister.
Thank you so much, Tina. Good afternoon, everyone, and thank you for joining us today. I'm pleased to be with Dr. Strang to talk about Nova Scotia's back-to-school plan for September. As we know, the end of last school year was a challenging time for everybody. As schools closed in March, kitchen tables turned into desks, and video calls replaced in-person instruction, and students and teachers had to adapt to a very different way of learning. And we learned a lot during this time, valuable lessons that have helped us plan for the coming year. One of the biggest lessons we learned is how critical it is that our children and our students are in school. Health experts, the IWK Health Center, public health, psychologists, and health professionals all agree that the best place for children is in the classroom. So today I'm pleased to confirm that our plan is for children and students to return to classrooms on September 8th. We have developed with our partners in health, the IWK and public health, and our educational partners, a comprehensive back-to-school plan which can be found on the government coronavirus website. The safety of our staff and students is central to our planning. As they return, there will be enhanced health and safety measures in our schools for our students and our staff. We have secured masks, hand sanitizers, and other personal protective equipment, and regions are beginning to distribute them as we speak. Staff who require additional PPE because of the nature of their work or any underlying health conditions will have access to what they need in our schools. Let me tell you a few of the additional steps we are taking to make our schools safer and mitigate against the risk of COVID transmission while we get back to the classroom. We're realigning our school classrooms so we can provide additional spacing for desks. Students and staff will be asked to self-screen for COVID symptoms before entering the building, and anyone who feels ill during the day will be immediately isolated and sent home. Masks will be mandatory on buses and in the hallways and common areas of high schools, and anyone who wants to wear a mask for their own benefit is free to do so. Younger children will bubble with their classmates and they will have recess and lunch together in that bubble. There will be no access to lockers in any school. There will be changes to schedules to support social distancing in hallways. Students and staff will be asked to wash or sanitize their hands before entering school and before and after lunch and when entering and re-entering a classroom. Access to schools will be limited to essential adults only. Parents will be asked to drop off at the door of the school, and all adults will begin any visit to the school at the office so they can be assisted in ways that limit access to the rest of the school property. Substitute teachers will be scheduled to work in the fewest number of schools possible. There will be no large gatherings such as assemblies, cafeterias, or concerts, and parent-teacher nights will be held virtually, online, or over the phone. These are a few of the health and safety changes that are underway in our schools, but I also want you to know that many parts of the school experience will remain the same, sometimes with some minor modifications. Many extracurricular activities will go ahead, including school clubs, if they can be done safely and in line with public health and safety guidelines. The full school curriculum is being offered, although there will be some changes to how music and physical education happen. Those will also follow the public health and safety guidelines. Pre-primary will be open in all areas of the province in September. Most school sports will go ahead. The Nova Scotia Athletics Federation has submitted their plan to support Nova Scotia, and as that's approved, they will be communicating sports schedules to the public. Parents and teachers told us how important high expectations are for student success, and teachers will provide report cards as per normal, and there will be appropriate assessments at all grades, and students will receive marks as usual. Food programs will remain in place, and food will be delivered to the students from the cafeteria. As much as possible, we want to retain the experience that makes school a special place for our students and our teachers. Public Health and the IWK advised us that a very small number of children won't be able to attend school due to health issues, and there are plans in place to support them, and they will not be penalized from an attendance perspective. Similarly, existing protocols that support staff with health issues will continue to be used. But we know that most children will be able to go to school, and we do believe that that's the best place for them. Medical and health experts tell us that children need school for their emotional, social, physical, and mental well-being, and we also heard that from parents and students themselves in the surveys that were completed. Our job in the education system is to make that experience happen in the safest manner possible. To do that, we will follow the public health guidelines and continue to work with our partners and families and students to integrate the new routines into our daily habits. I know many parents are worried about lost time and how their children will respond in September. I want you to know that beginning in September, teachers will undertake a comprehensive assessment of students and work to close any learning gaps that exist. Teachers will spend the time to get to know your children and their strengths and weaknesses, as they always do, and they will quickly learn about student gaps and strengths and plan their instruction in response to that. We've also provided some professional development opportunities in this regard for teachers over the summer, and we've had a pretty high uptake. Close to 1,000 teachers have enrolled in that program. We'll work with regions and principals and teachers to ensure that students receive the supports they need and that they can transition back to school effectively and learn the new COVID routines easily. We know that students do best when home and school work well together. Next week, we'll be uploading videos and other supports to help parents prepare their children for school using COVID protocols, like helping them understand why we use masks and helping them be independent at wearing them. I'm encouraged by the results of our parent and student survey. We received 28,000 responses, and more than 80% thought students would transition easily back to the classroom. For those who need more help, we are ensuring supports are available through Schools Plus, through guidance counselors, specialists, child and youth care practitioners, teaching assistants, and other staff who are there to support students. In response to at-home learning, you told us we needed more access to technology, so government has purchased 14,000 computers. We will ensure that every child who doesn't have access to a device at home will receive a device in the event that online learning is required. We will prioritize those who are unable to participate in online learning this past spring. We heard that you want more predictability in learning, so we are setting expectations for teachers and ensuring that there is consistency in approaches to instruction. If we move to online learning, teachers will deliver a mix of real-time instruction and self-directed assignments. We are also ensuring that students who need additional supports receive them. If we should move to online learning, if COVID requires that, our TAs and EAs and child and youth care practitioners will be provided with the option of working with students in their homes, while others will provide support through virtual means. Our commitment to additional supports means we are also hiring additional support staff to ensure that our students are successful and have plans to redeploy staff across the system, even within the Department of Education, if that's necessary. Safety, equity, flexibility, and commitment to our quality education, this is what is driving this back-to-school plan. And we recognize that we are in new circumstances and that we are dealing with a global pandemic that has not gone away, so we need to be prepared in case COVID does affect our schools and our province. I want you to know that we are ready for that. Our plan allows us to deal with one school or many. We will take our direction from public health and we will be precise and flexible. We have the ability now to respond to local issues either at one school, a family of schools, or regionally, so that if COVID is showing up in one particular place in the province, we can respond specifically to those situations while not affecting the learning environment of students across the province. If needed, we can move to a blended learning model with pre-primary to grade 8 and reduced classes, and grades 9 to 12 doing much of their learning from home. And again, this can be on a case-by-case, school-by-school scenario. But this at-home learning will be different. It will include access to school supports for specialty programs like skilled trades, or which will be on a modified schedule. Students who require additional supports outlined in IPPs and those without internet at home will be still able to access school in a blended learning model. Schools will also assign student success center rooms with socially distanced desks where students can book for appointments for additional help from teachers and other staff to ensure they can be successful as they can be. In blended learning, students in grade 9 to 12 will be able to access busing to access supports they need at school while they learn from home. If the situation warrants going further, we will move to online learning totally if directed by public health to do so. We recognize that the impact of COVID-19 may be different across the province. That's why our plan allows for regional and local flexibility. For instance, at the direction of public health, we may require at-home learning for some localized schools while the rest of the province remains in class. But our priority is to keep children in school with their peers, a spot that health professionals and parents and students themselves have told us is the best place for them. Throughout the school year, the department will be working closely with public health staff so that we remain agile and nimble so that the epidemiology steers our student-focused response. I want to thank everyone who participated in the development of this plan, including Public Health, the Provincial Pediatric Advisory Group at the IWK Health Center, the Nova Scotia Teachers Union and teachers, and principals and other education partners and unions. Your input has been vital in producing the best possible plan for students, families, and staff. And the strength of this plan rests on that collaboration that helped develop it. I also want to thank all the parents, guardians, students, and employees who wrote, emailed, called, and passed along feedback to the department through surveys or directly in the form of letters. Now over to you, Dr. Strang.
Thank you, Minister Churchill. Good afternoon, everybody. I certainly agree that the best place for our children to be for their learning is in school. As with other aspects of managing the pandemic, this is a matter of balance. On the one hand, as we reopen our economy, our society, and our community and schools, we do increase the risk of transmission of COVID-19. But on the other hand, keeping everything tightly closed down also has substantive risks and is not something we can do for the long term. We know that our children need to be in school, not only for their academic learning, but also for their overall development and their emotional and psychological health. We also know that parents have faced significant challenges since schools closed in March. Our current epidemiology shows that virus activity remains very low in the province, and education leaders, as we've worked with them, we together have developed a plan with appropriate public health measures for returning to the classroom. So I'm fully confident that as the plan we have in place allows us to have children back in school, the optimum place for their learning, while we have appropriate COVID safety measures in place. I'm comfortable that with school resuming, it will present or bring a sense of normalcy back into the lives for Nova Scotian learners and teachers. However, we have to recognize and understand that this is not like everywhere else. This new normal in schools, our learning environment, will not be pre-COVID normal. The virus is still present. We are, at risk of it returning back into Nova Scotia, and we must continue to be vigilant. The Nova Scotia's back to school plan does create that new normal in our schools. Like we've been doing with our workplaces, community settings, our whole range of businesses. It's about creating an environment that allows whatever happens in that setting to happen, but with an appropriate steps in place to provide a safe environment, to ensure we're creating environments where all the personal preventive measures, whether it's physical distancing, staying home if you're unwell, masking if you can't remain physically distanced, increased hand washing, cleaning, all those things need to be in place, and they are in place in this school plan. And there's some unique pieces of that and some of the unique elements that happen in schools. So I fully believe that we have a very reasonable and practical health and safety measures to find that necessary balance of allowing kids to be in school learning, if at all possible, with an appropriate level of safety. As I've said, we have the work that my team has been doing is with our education colleagues in the IWK. Also, when working with our public health folks across the country, is how do we create an environment, as I said, that supports all those personal preventive measures. We have to understand that there are no risk-free environments, but can we have an appropriate level of risk? We also have to understand that there is certainly a possibility that we will see cases of COVID in school-age people in Nova Scotia. That doesn't necessarily mean that the transmission was in school. It might be. Certainly, if we do have some sporadic cases in school, that's certainly entirely possible. It doesn't mean that our plan was wrong. It doesn't mean that we have to rethink everything. The plan is based on the contingencies of working at a local level, like we do for all COVID cases, that local public health will follow up specific cases, understand where exposures for that case may have happened, understand who might have been exposed by that case, and then we'll work with our education colleagues, as the minister said, whether it's an individual school, a family of schools, even a regional center for education, to take appropriate steps. But our approach around COVID and this reopening is, if at all possible, whether it's schools, businesses, community settings, that we avoid broad measures that are applied across the whole province. Where our goal is to have a more targeted, focused approach, and part of that with the schools is making sure we have and I'm confident and know that we do, a good working relationship at a provincial level, and also at a local and regional levels, that we are working together as events as the fall unfolds, that we are monitoring and adjusting our plan. It has the various scenarios in it that we can create flexibility to respond as the fall occurs and if we get COVID cases. I've been asked before about have you certain targets, specific numbers that we would shift, and my answer is no. That every case that occurs, we need to look at the individual circumstances around those cases, around the unique environments that maybe happen between one school or another, and apply appropriate measures. But I want people to understand that as we move forward, that public health will be here working with our education colleagues, and our goal is to create conditions that allow kids to be in school learning, and teachers can be safe as well, and then working with education to provide appropriate adjustments to our plan as necessary as the fall evolves and as COVID evolves. I'm also very pleased, my public health colleagues continue to work hard. I'm very pleased about the relationship with the IWK as well, and my pediatrician colleagues who have very much offered their time and their expertise to support the need for a safe learning environment. Thank you, Minister.
Thank you. We'll now move over to the question and answer portion of the news conference. We'll start with Keith Doucette from the Canadian Press. And again, just a reminder, we'll take one question, one follow-up from reporters on the line in the allotted time we have. Just another reminder, too, to keep your phones on mute. Go ahead, Keith.
Yes, I'm wondering what provisions, will there be extra duties for teachers in terms of ensuring that students are adhering to COVID rules outside the classroom? In other words, in areas of the school when they're not in class? I don't see where that's clear, and how is that going to work?
Well, it's going to work the same as it does with all the rules and regulations that we expect students and staff to follow. The enforcers of those rules are our teachers, our support staff, our principals and vice principals, and we are asking them to help obviously enforce the new COVID protocols. But more importantly, we need our kids and our students to understand why these things are important, why these new habits that we're trying to develop in our schools are critical to keep people safe, and how by abiding by these rules we can avoid an increased risk level of transmission of COVID-19. So it's the same expectations that there are with all rules and regulations. We expect them to be followed, and our staff are there to assist us in ensuring that they are to the best of their ability.
Go ahead, Keith, with your follow-up.
Yeah, on the sports question, I noticed you said most sports. Are there any sports that you're not going to restart? I'm thinking about large team sports like, say, football, where there's a lot of physical contact and included in the sport. Do we have any details on what exactly kind of sports will be allowed to go ahead?
So school sports are governed by the Nova Scotia School Athletic Federation, and they have developed some guidelines. I believe those guidelines have been submitted to Sport Nova Scotia and may very well be with Public Health for approval. As we get closer to the fall, the NSSAF will be releasing the sports schedule and any changes to that schedule based on the guidelines that they've developed.
So maybe I'll add to that. So the NSSAF plans are right now with my colleagues in Sport Nova Scotia and Community Cultures and Heritage. I've asked them to review those plans, make sure that they're consistent with our overall return to play plans for all sports in the province. And they're doing that work, and they'll come to me for further conversation and a kind of final assessment, and then taking that back to the department as well as to NSSAF.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Good afternoon. I just wondered, Dr. Strang, since the beginning of this pandemic, actually before it hit our shores, you have been saying the 2-meter rule is almost sacrosanct. You're waiving that 2-meter rule in the classroom. I need to know why you think that's safe.
So we understand that the physical distancing, any of the public health measures don't operate in isolation. So we're comfortable where we're at with the epidemiology, and even where we might predict the epidemiology going in terms of low, sporadic cases. That a layered approach that allows physical distancing, where it's feasible, along with hand washing, wearing masks on buses, keeping kids home if they're feeling unwell. All those apply appropriate level of safety. It's not that we're not going to have any distancing. We're going to work to keep kids apart as much as we can in classrooms. And they're adjusting, taking things out of classrooms so we can increase the space between desks. Our goal is to have at least a meter space between desks, and it's that first meter which is the most important meter. But we also, this is about balance, Sean. We've said that we need classrooms to function and be effective as a learning environment as well. So I'm comfortable that with the other measures we have in place, that with the 100% plan, that we're can operate on, not have a strict commitment to the 2-meter rule. We're also, one of the key things in there, we're operating on classroom cohorts. So each classroom is meant to be separate from the other classrooms in the school. So that's another layer of safety about, if we do have some transmission, it stays within a single classroom. So this is all about multiple measures working together and balancing things between COVID and creating effective learning environments. Having said that, this is one of the areas that we might strengthen if we see events unfolding in a school or in a local community around an increased risk of COVID. We can certainly look at strengthening requirements around masking, strengthening the need for physical distancing, and that is the blended model, which is all about, if you look at the blended model, that has a much stricter requirement around maintaining a 2-meter distance. So this is all about balance, and then we have the flexibility to strengthen if necessary.
Go ahead, John, with your follow-up.
My follow-up is for the minister. Minister, you said that this at-home learning will be different than last time. You're also promising to allow kids who are struggling and who need those extra supports to get them face-to-face. Is that a tacit admission that what was in place after March break just wasn't good enough?
Well, listen, in March we were in a crisis response situation where we had to make decisions very quickly, and the looming threat of a COVID-19 outbreak was directing all of our decision making, and I think we acted appropriately and in line with public health directives. However, now that we've had time to plan a response instead of it being reactionary, that plan is improved. So we know that many or a number of students struggled in the at-home learning environment. That was difficult for many families. We know that access to specialty courses was not possible in that environment, and that access to technology was an issue as well. So in the event that we have to go to a blended learning model, technology will be provided to students. There will still be access to school for those that do not have the internet or who are participating in specialty courses like skilled trades, for example. There will still be busing available for those high school students in the blended model who will be doing the bulk of their learning from home. And we will have those student supports available, teaching and non-teaching, that may be available in person as well. And we will have student success centers available in school by appointment so that students are able to get in and get the additional supports that they want. So yes, this is an improved approach from last year, and obviously the learning experience that we all went through last year has helped us develop this plan, along with the feedback from the 28,000 parents, students, feedback from union leadership and staff and administrators as well, has helped develop a much better and robust response to ensure that students are getting the very best from their system, the education system.
Next, we'll go to Jeremy Keefe from Global. Go ahead, Jeremy.
Thanks. I'm wondering if you could give us an idea of what exactly led to the decision to return students to classrooms 100% rather than move to more of an at-home learning model. I know that you've mentioned that there's appropriate steps in place, but it seems to me that if schools are going to be open, if students are going to be in schools 100%, there's a very real chance that if COVID cases return, that's somewhere where they could spread quite easily.
There is a consensus amongst medical experts, child development, mental experts, and a consensus that we saw from parents and students from the surveys that school is the best place for our kids and our students to be. That's where they have the best chance at succeeding and excelling in their learning journey. And we agree with that. Our job in the education system is to deliver the best education possible to our students, and we can do that best in the classroom. I think we have planned responses now to any increased threat level of COVID-19 that will allow us to respond in localized and efficient ways to keep the learning experience optimized to the best of our ability, even if there is an increased risk of COVID-19.
Go ahead, Jeremy, with your follow-up.
You mentioned the possibility that if things change, that we could transition to an at-home learning model. Is there any ability to give us hard numbers in terms of what kind of COVID numbers we would need to see for a similar shutdown to what we saw around March of this past year?
So as I said in my remarks, we're not going to set a specific target or number that we would look at, which would trigger that. It's all about public health, looking at the epidemiology, following up individual cases and the circumstances around those cases, and then working with our education colleagues around what are the appropriate responses that we might need to put in place. So there's no firm target of a number. It's more around where are we seeing transmission. What is the kind of risks that are happening that are driving transmission, and then what we might need to put in place in the education system, and that could be, as we've said a couple of times already today, it could be a single school, could be a family of schools, could be bigger than that. A lot of it is driven by an understanding of the epidemiology and the context of epidemiology ultimately is just numbers, but it's also working with our education colleagues on the context of what's happening in schools, and then what is the appropriate response we might need to take.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Hi. I just wanted to clarify, so masks are needed for all bus riders and drivers on the way to school, but once at school, is it only high school students that require masks in common areas? Why not younger students?
The reason is because in high school you have students that are transitioning from class to class, and there's more interaction in the hallways as a result of the high school schedule, whereas in the elementary school level, students are in the same class all day, so it's much easier to cohort. So that's why masks are mandatory going between classes and being in the hallways, because there's less ability to create an environment of social distancing there, which is very different at the elementary level.
Go ahead, Natasha, with your follow-up.
Okay, and just to be clear on the sports issue, so at this point in time, it appears that as long as there's a plan in place with the health department, all sports should resume in some form this coming fall. Is that right?
So I'm going to jump in. So the sports have to be consistent. The NSSAF plan needs to be consistent with the return to play plans for that Sport Nova Scotia and all the provincial sport organizations are going to do. So we will not be having something different for school soccer than we do for soccer in general in the province.
Next, we'll go to Cassandra Nadeau-Lamarche, Radio-Canada.
Oui, merci. Minister Churchill, you talked about changes to music and arts and physical education classes. Can you expand on that?
Sure. So there's guidelines available. They're in an appendix to the back to school plan that was released today. So there's going to be some changes. So distancing is obviously more important now in phys ed and music class. There'll be more focus on being outdoors in phys ed and on skills development that do not involve close interactions, where bodily fluids can move around more freely between folks. The same goes for music class. So we'll have disposable receptacles for any instruments where there's saliva. There'll be strict cleaning processes in place, and not every music activity that doesn't fit within the guidelines will be able to be in those classrooms.
Go ahead, Cassandra, with your follow-up.
Yes, I think this would be for Dr. Strang. So at the end of the day, is it the vaccine that's going to make it go back to a more normal situation?
So that's a big question. There's a lot we don't know about this virus, and there's a lot we don't know about the vaccine. And a lot of people look to the vaccine as a solution, but if you talk to a number of vaccine experts, we look at influenza vaccine that is modestly effective. It's still useful to use, but I think we got to be cautious and not put all our eggs in that a vaccine is going to solve everything. It may be a number 1 or 2 years before we actually say that we're now at a place where a combination of vaccine or developing ongoing immunity in enough people in the population allows us to kind of relax somewhat around our COVID measures. But we'll only understand that as the months and even a year or more evolves.
Next, we'll go to Rebecca Brown from allnovascotia.com. Go ahead, Rebecca.
Hi, thank you. I understand that some classes, elementary school classes, for example, will be moved to bigger or less occupied schools. And I'm just wondering, why was moving kids to different schools chosen as the solution to address space concerns?
So this would be in the blended model. So in the blended model, if public health determines that we need to move towards this either in a localized fashion or more broadly, high school kids will be doing the bulk of their learning from home, although as I mentioned, they still will be able to access specialty courses, school supports, by appointment. But in the blended learning model, we're going to have the bulk of our high school kids that are not in those buildings, and that allows us to move our elementary school kids around in such a way where they can fully social distance and take all the precautionary measures to avoid transmission. And we do have plans in place right now regionally that map out exactly how that will look in the event that we need to move to a broad blended learning scenario.
Rebecca, go ahead with your follow-up.
Sure. Just to clarify on that one, though, so no students will be not the blended model, in the 100% return model, no students will be in a different school than they would normally be?
No, our plan for September is to get kids back in school, students back in school in their usual schools, following the new health and safety guidelines and protocols.
Thanks, Rebecca. Next, we'll go to Ed Halverston from QCCR Radio in Liverpool. Go ahead, Ed.
Okay, so did Rebecca your follow-up?
Yeah.
Yeah, I don't think I got my follow-up.
So, Rebecca, one question, one follow-up. Your clarification was your follow-up. We'll go to Ed Halverston from QCCR. We have a number of other reporters on the line. Go ahead, Ed.
Yes, thank you. My question's for the Minister. There's been no talk about playground equipment, particularly with younger students. How will that be managed in order to follow the COVID-19?
So I think we're understanding more about how this virus is transmitted. If we have kids with well-washed hands, the playground equipment outdoors, the virus is not going to persist to any great length of time. And it's not a major. We're seeing that these type of surfaces as well. It's important where you can feasibly clean things that to do so, but they're not the major driver of transmission. So I think really to me the focus would be on making sure kids are washing their hands before and after they go out there. They're out for outdoors, but potentially playing on the playgrounds. Clean hands that go on, and having those hands clean when they come before they come back into the school, and not worry so much about the playground equipment itself.
And further to that, a precaution we're taking is cohorting as well. So the cohort, the bubble of students in school will be participating in recess together, in lunchtime together, and that is another precaution to help us avoid transmission as well during those times when playgrounds are in use.
Go ahead with your follow-up, Ed.
My next question is about the mandatory mask use. Are there repercussions for students or perhaps their parents who refuse to follow that order? Will they be forced to do online learning? Will there be suspensions? Has that been laid out yet?
If this is in the guidelines, if there is a legitimate reason why a parent or student has concerns about wearing a mask, they can approach that situation to their principal and school teacher to discuss what potential solutions there can be. I don't know, Doc, if you have anything you want to add to that.
We're taking, more of a positive approach to this. Part of our communication moving forward around masks in general, and we're working on some things specifically for families and learners as well throughout August. There are some valid medical reasons, but they're small in number, and so our hope with that families would understand that having their children wear masks is about protecting the other kids, whether it's at school or on the school bus, and that by everybody who can wearing a mask provides the maximum level of protection collectively. So that our hope is that people understand that, and they're not looking for reasons to have their children not wear a mask unless there is a valid medical reason for that.
Next, we'll go to Stuart Peddle from the Chronicle Herald. Go ahead, Stuart.
Yes, I'm wondering about if there's an increased risk because of the duration of any particular class or the school day. You mentioned cohort, and keeping kids together, of course, reduces the risk of other people spreading it to them. But is there an increased risk if one of those children in a cohort does happen to have the virus, if they're with that same group in a class for hours and hours at a time for the day? Is that a risk as well?
So, I mean, there is, we know that increased, one of the risk factors, the longer the potential exposure, or both the closeness and the length of duration of exposure increase risk. But this is where it comes back to the layered approach, that if we have making sure that that kids who are not feeling well don't come to school that day, the same with teachers. Or if somebody becomes unwell during the day, I know that each school is meant to have plans where that individual can then be isolated as quickly as possible until arrangements can be made to get them home. So certainly steps in minimizing that. But the other pieces, like staying home if you're not feeling well, making sure we have good hand washing, all those other pieces that will together minimize the risk of somebody being in the classroom in the first place, and then certainly taking immediate action if somebody becomes unwell and removing them from that environment as quickly as possible.
Go ahead, Stuart, with your follow-up.
My follow-up is if it's safe enough for kids to go into school in the fall, why can't the media have a news conference with the provincial officials?
I think as with any plans of reopening, government is working on plans to make all these reopening things safe. It's happening with the economy, it's happening with education, and I think it's happening on other fronts as well.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, Dr. Strang. I'm wondering if you could just speak to what the current understanding of the epidemiology is, specifically in terms of asymptomatic children spreading the disease to adults, like their parents back home or to teachers in the classroom?
So certainly that's potential. There was the late, evidence continues to evolve. I think on the weekend even there was a release of a large epidemiologic study from South Korea, and the conclusion from that was that kids that under age 10 weren't very efficient transmitters of this virus, and that many of them may be asymptomatic or have very mild symptoms, but that those younger ages not very efficient transmitters. Certainly, the sort of ages 10 and up from that epidemiologic study showed they had about the same rates of transmission as adults would have. But we also know in general that while we have to recognize there is a risk of asymptomatic transmission, that people who are if they are asymptomatic transmitters, they're not as effective or efficient transmitters as people who are symptomatic. So yes, we have to recognize asymptomatic transmission, but that's why we can't look at schools in isolation. This is all about how do we minimize transmission in communities, and therefore because everybody coming into the schools is coming from those communities. So we don't look at the school just in isolation. But we have to accept that that's a reality. Our goal is not to have 0 cases of COVID. That our goal is to actually create safe environments and then have a health system and a public health system that can respond quickly and as much as possible keep isolated cases, or having them remain isolated with quick follow-up and appropriate action, and minimizing the chance of wide community spread or widespread in any setting. So we have to accept, I think it's important that Nova Scotians understand that our goal is not to have 0 COVID come the fall. We will get more COVID. We will in all likelihood have some COVID in schools. It doesn't mean that we can't have safe environments for the vast majority of learners and continue to have them in schools as much as possible. However, we also have plans in place that if we need to have more kids learning from home, that's what today's plan is all about, is creating that starting point, but also flexibility, that if we need to have a higher level of safety as things evolve in the fall, we have plans in place to produce that higher level of safety.
Go ahead with your follow-up, Tim.
Okay, given that response, I would want to ask the minister, what about older teachers or teachers with underlying health issues? Will they be able to stay out of the classroom, or are they going to lose their jobs? What's the how are you thinking about that, and what's the policy on that?
Sure. So obviously no one's going to lose their job if they have a health issue or if they get sick while they're teaching. There's the standard approach to that situation is not going to change. Staff who require additional protective equipment, we will provide that. If they do want it and meet the criteria you outlined of having underlying health conditions. And that can be a non-surgical mask, surgical mask. We have also purchased face shields as well, which can be used. I think they'll most likely be used for those support staff who have very close contact with students who are more likely to have bodily fluids that support staff or teacher might be at risk of getting on them. So those face shields will be available to them, and teachers that have underlying health issues that want to have multiple layers of personal protective equipment will not only be able to utilize those, but we will provide it for them.
Next, we'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thank you. I'm wondering, where will more hiring be needed under this plan? Are you planning to hire more cleaning staff from September? And it seems you'll need more teachers to be ready in case the classrooms spread out under the blended model.
Our plan has already been to hire more teaching and non-teaching support staff through our inclusive education funding. This year we have an additional $15 million, which brings that pot of funding for those staff up to $45 million a year to date. Those folks will be deployed in the system in a way that can best meet the needs of students. Regional centers of education will be conducting more frequent and enhanced cleaning and disinfecting protocols. In some cases, that does require to hire additional staff, and the regional centers of education are in the process of doing those hires right now, actually. So where more cleaning staff is needed, they'll be there. And we are hiring more support workers and teachers for the fall. Those jobs are currently being posted as well. And we also have a plan to redeploy staff, if necessary, from our regional centers of education and even our Department of the Department of Education, if those staff are required to meet the needs of students.
Go ahead, Kyle, with your follow-up.
Okay, cool. This one's for Dr. Strang, I believe. With public health now comfortable with classrooms holding, like, we're looking at up to 30 people here without 2 meters of 2 meters of our physical distancing, does that mean you'll be considering raising the close gathering limits for the general public as well, to, from the current 10 people to something like 30?
No, I mean, our current gathering limits are we can have close groups of social groups of 10. We're not looking at changing that. We have to understand that we're seeing more and more that COVID is being spread by close, prolonged contact, especially in social environments, bars, parties, etc. So those are highest risk areas that we need to be very careful of. Those are very different from an essential place like a school, where, as we've heard throughout today, that for many reasons that is the best learning environment, and we have to create an appropriate level of safety, but also respecting that we need kids in the classroom as well. So just because we're doing certain things in education, people shouldn't translate that we may be more relaxed in other areas that aren't necessarily what I would call essential.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Thanks. Minister, you mentioned the $15 million to hire additional people, and of course your plan outlines efforts to hire more educational assistants. Where are these folks going to come from? How many do you expect you're going to need, and how confident are you that you can meet whatever needs kids show up with in September?
Well, we've hired additional staff every year. The hires that are posted for right now will be in line with hires of past years, because we are looking at around the same amount of money. And I think a real key is that these folks can be deployed in a way that particularly helps those students who may have fallen behind over the last number of months, to help them catch back up. So early in September, teachers and principals and vice principals are going to go through their process of assessing where students are at, and then developing learning plans to help those who need additional assistance catch up to where they need to be. And of course, having additional teaching assistants, child and youth care practitioners, mental health clinicians, and the other support staff that are hired through our inclusive education plan will help meet those goals for those students.
Go ahead, Mike, with your follow-up.
Thanks. Dr. Strang, I appreciate that you can't really define for folks what would necessitate a school being outright shut down or an area going into blended learning, but I'm wondering if either of you could talk about who ultimately gets to make that decision, who has the final call on whether or not that happens. And also, Minister, I'm wondering if a kid in a school tests positive for COVID-19, will other people attending that school be made aware of the fact that someone has tested positive?
So I'll answer your second question first. And so we have a process in place that we use on an ongoing basis. Any notifiable disease, whether it's pertussis, chickenpox, measles, mumps, we have lots of them. That one of our first steps when we work with the school is make sure there's communication, usually in the form of a letter, or nowadays that's emailed out. That goes out to whether it's all the parents in that classroom or the whole school. So we'll certainly absolutely communication to families is a critical part of our response in any infectious disease event in the schools, and that no different for COVID-19. To answer to your first question, I think it's made very clear in the plan that ultimately it's under my authority under the Health Protection Act that I would be giving, working with the Department of Education to make sure they have appropriate steps in place, and if a school needs to be closed down, we'll do that together.
That's all the time we have for questions today. Go ahead, Minister.
Thank you very much, Tina. Thank you, Doctor. And thanks, everyone, for tuning in while we unveiled our back-to-school plan. Again, this plan was developed in consultation with the IWK, Public Health, the Nova Scotia Teachers Union, our administrators, and other union partners as well. And I think that we can have confidence in this plan. It helps us achieve the balance of mitigating against the risk of COVID-19 while we're creating an environment where our students can learn and develop to the best of their abilities. And I do want to thank again all the partners who helped us develop this plan. And we're really looking forward to getting students back in September and giving them the education that we know they need. Thank you so much again for your time.